Good morning, ladies and gentlemen. How are you doing today? I want to welcome you to today's edition of our tutorial. Last week we've been talking on basic life supports, and we've been treating on the various aspects of the basic life supports, and we've tried to understand the importance of these subjects in our day-to-day activities. When you look around and see how easy people, or how frequent people are now collapsing, or going into coma, going into heart cardiac arrest issues, you see the need for you to understand what we've been trying to teach, or the information we've been trying to pass across to enable you get equipped, with the right information that you need, for every moment that you are faced with some kind of crisis. Sudden cardiac arrest is something that can happen anytime. Most of the time, it does not happen in the hospital. In fact, 90% of the cardiac arrest that occurs, they occur outside the hospital. They occur in the marketplaces, they occur on the road, they occur in the school, they occur at home. Okay, they don't happen in the hospital. So that is why it is important that you get this information, understand how to handle issues that border on sudden cardiac arrest, on hypertension, on stress, so that you don't get overwhelmed or get confused when you see someone who is under the attack, right? So this video or this tutorial we've been reading out is an opportunity for you to acquire enough information that you need to act effectively, especially when you happen to be the person, or when you happen to be in the scene where the events occur. Right, today we'll be talking about AED. Since last week, we've been dealing on the component of basic life support, of which AED is one of it. Last week we talked about CPR, cardiopulmonary resuscitation, and we tried to really do justice to it, try to decipher and expound on it, so that we can understand very well what CPR is all about, how to administer CPR to adults, infants, and of course children or a child. What are involved during the administration of CPR? We dealt with all that. The video is there on in our YouTube channel, in our studio, so you can just go in there and pick it up. So, but while you are watching this video, I would like you to make sure you always like. If you look down under this video, you will see the like button, you see the share button, and you see the subscribe button. All I need you to do is to click or hit the like button, the share button, and the subscribe button. It will help you to get directed to where other videos are, especially the CPR lecture video and the introduction to basic life support video. You can easily access them when you go to our studio. All right, so and aside you getting access to all those videos, it will also help as many of your followers who are also part of your community to also have access to those videos, because once you hit on the like, share, and subscribe, it sends signal to them to also receive the information on what to do and how to act. All right. Okay, so having said that, let's head on straight to what we have for today. Like I said earlier, we have what we call AED, automated external defibrillation. Automated external defibrillation, like a layman, they want to ask, what is this thing all about? Is it, can you just explain to us what AED, does? What is it? Is it chewing gum? Is it sweets? Is it what exactly it is? Is it that many people want to be very curious about knowing what it is? So it's just nothing other than a device that helps the heart to regain its normal functionality. Okay, it is called external automated external defibrillation, which helps to defibrillate the heart when the heart becomes fibrillated. Okay, it's just like words and opposites. Okay, it's just like saying a virus and antivirus. So when the heart becomes fibrillated, you get AED, which is a defibrillator, to restore it. Now, automated external defibrillator is a portable device designed to analyze the heart rhythm. It analyzes the heart rhythm and restores it. When the heart rhythm begins to malfunction, it is disorganized, is disoriented, then you need an automated external defibrillator AED to reorganize it, analyze it, and reassemble it and restore it back to its normal functioning mode. Right, so and it helps the heart to begin to function well again, and also treats the the sudden heart attack, handle sudden cardiac arrest rather, that could have resulted in the cause of the abnormal functioning of the heart that just sets in. So AED helps to restore the heart back to its normal functionality. So, but just like I said earlier, someone will want to know the importance of this AED. I'm going to give you about 3 importance of AED. Just like we treated in our last video about CPR. CPR is being administered to someone who collapses or who suddenly falls into sudden cardiac arrest, and the person probably must have lost consciousness. The person is passing out. The pulse has stopped, showing up or beating. The heart has stopped. Almost the entire system is packing up. Then what do? When you see such a scenario, you administer CPR. Okay, so when you administer CPR, the person begins to regain consciousness, and the CPR is just a procedure that directs the blood or gets the blood again from the heart down to other organs of the system, and also around the entire system, especially to the brain. So it directs the blood round when the blood has stopped moving, packed up in the heart because the heart is no longer beating. So CPR, which is an artificial heart, gets the blood out and transmits it around the system. So now, what does the AED? How does the AED help the CPR to accomplish this? Because the AED, in case the heart has now come to a point where it needs the application of or deployment of the AED, how does it help the heart to reorganize itself so that a CPR can now be administered to help the heart to come back? Number one is it increases the survival rates when used promptly. Okay, so when the heart is packing up, when the heart has been disoriented, the AED, when it's deployed, it helps to reorganize and reassemble the electrical connectivity of the heart, the electric circuit of the heart, and now gives it the opportunity again to function properly, to enable the heart to begin to flow again. Okay, so that's the first thing it does by extending the survival rate of the person who is already packing out by reassembling it. So the number 2 is the AED also aids the bystanders, those who are there, who doesn't know what to do, to quickly help the person that is under the attack to begin to regain consciousness, especially if someone is there to help the person or the bystanders, or a bystander has a little knowledge of how the AED behaves. So the AED can easily be deployed so you mustn't really necessarily be a professional. You mustn't be a professional before you can be able to handle AED. So if a bystander or a passerby or someone who is just standing, viewing or looking at the scenario, understands how to use AED, the person can easily deploy AED, and such a person the person that is under the attack can begin to receive help from the deployment of the AED. Another importance of AED is the fact that it is transferable. You can you can move it around. So it can be found in the offices, it can be found in the schools, it can be found in the airports, it can be found in the mall, it can even be in your car. It is movable, it is mobile. Yes, I think that's the right word. It is mobile. So it is mobile. That is how important it is. It is mobile, so you can actually move it around, so that whenever you meet a scenario where you can easily deploy it, then one can easily know what to do. That's all about that. Then the next section we're going to treat is the objective of AED. Objective of this AED lecture or tutorial. Why are we teaching people the how to handle or manage AED? The first one is we are teaching you what to do or how to handle AED, so that you can understand how AED works and when to use them. So when you don't know how to use AED, or when you don't know what AED is all about, you will not understand what AED is. So we want to give you an understanding, the background, the fundamentals of AED, so that you can now know how to use AED and when to use it. Then the second one is to identify the step-by-step usage. Okay, how to use AED safely, which we are going to talk about in the course of this training or course of this tutorial. So you need to identify the steps for using AED safely, so that you don't use it in a way and manner that the person or the victim will also be affected. And also you recognize the AED safety precautions. The reason why we're teaching passing this tutorial is for you to recognize what we call AED safety precautions. What are the precautions? When you want to deploy it, what are you supposed to know? That is it. So, and the last objective is to learn how to combine AED use with CPR for maximum effectiveness. Remember, I told us earlier that for you to deploy AED on a victim, is possible that the CPR administration has failed, right? There is no pumping of blood, there is no available blood, because there has to be available blood for the CPR to work. So if the heart did not release blood, which is always always found around the ventricular region, if there is no blood within the system, then it is difficult for the CPR to be administered. But when you now have an AED being deployed, it makes the entire ventricular part to now be in the normal position or normal mode for it to release the blood for the CPR to take its function. So you need to understand how to interact the AED and the CPR at the same time for maximum effectiveness. All right. So now, how does AED work? Very important. How does it work? Well, before we talk about how it works, we need to also understand what happens when you want to deploy AED. AED delivers a controlled electrical shock to the heart to stop an abnormal rhythm. It delivers electrical shock, a controlled electrical. I call it a controlled electrical shock because it's not something that once you connect it will start shocking and releasing shock, electrical shock and all that. It delivers a controlled electrical shock, to the heart of the victim once it is deployed. Heart of an abnormal rhythm. Okay, a heart that has already gone into abnormal rhythm, it delivers that shock in order to reorganize it, in order to realign it, in order to reorientate the rhythm, the lines of the hearts. I explained earlier, the heart is just like a battery, a car battery that has electrolytes inside it. But in this case, the electrolyte of the heart is the potassium. But in a battery, the electrolyte is usually the acid. But so now it has electrolyte and the electrode that is being dipped inside the electrolyte for the for connection to occur, right? Now, when you have that electrical connection, then current will be sent out. That is what happens in the heart. When the electrolyte synchronizes well with the entire connectivity within the heart, then there is a clear signaling of the flow of blood out of the heart, to the system. So it is that connectivity that actually makes the heart to quiver, to pump, to compress and pump. If the connectivity is no longer working effectively, the heart cannot compress. You can't compress and open, compress and open. It's the compression and the release that makes the blood to flow. All right. So, but when there is no when the connectivity or the rhythm is not in order, it's not working accordingly again, then there is difficulty. There will be difficulty there will be difficulty in the compression of the heart. So that is what the AED restores when you deploy it. Now there are two aspects of heart malfunctioning that occurs before you can begin to talk of deploying the AED. The first one is the ventricular fibrillation and then ventricular tachycardia. These are two threatening arrhythmias. They are two threatening malfunctioning or disorganization that if you don't handle it properly, the person, the victim that is having this issue might die. Right? So let's first of all begin with the first one, the ventricular fibrillation. Now, first of all, let's understand what fibrillation is. I told us earlier that if there is fibrillation, then there has to be defibrillation. Okay, the essence of bringing in defibrillator is because there is a defibrillation in the system. Now, what is fibrillation? So there is a fibrillation rather in the system. Now, what is fibrillation? Fibrillation is a rapid, irregular, and uncoordinated contraction of the muscles of the heart. When the contraction is not being coordinated again, then there is what they call fibrillation. And how do you handle that? You bring in AED. Now, when the contraction is no longer working effectively, there will be difficulty in blood pumping. The blood cannot leave the heart again because there is no coordination. The entire system is no longer working, together. Right. So you now have to bring in, defibrillator. Now, the ventricular fibrillation is telling us that it happens around the ventricle. The ventricular region is the region that is just under the heart, where that looks like a balloon. There are two sides of it. They have the left ventricle and they have the right ventricle. So there are two balloons. All right. So it can occur. Each of it can occur anywhere, what the tachycardia or the fibrillation, ventricular fibrillation. So, but when you have the ventricular fibrillation, that makes the heart to quiver instead of the heart to have an organized connectivity and the organized, articulation of the entire muscle system of the heart. Then you now begin to have a disorganized system. Now, when you have that disorganized system that is not connecting and working well in order to produce signal that will send the blood out of the heart, now the heart will now begin to quiver. Instead of compressing, it will quiver, it will shake, it will vibrate, it will become very chaotic, it will not work the way it should. Now you need to introduce what you call AED, automated external defibrillation, that will now reorganize and realign the lines, the connecting lines, and reassemble them, so that there will be a normal rhythmic pattern that's supposed to send the blood out of the heart. Now, what can cause this thing to happen that way? The first one is when there is a heart attack, when there is an attack in the heart. When the heart is being attacked, then fibrillation will come in. There's another number. And then number two, when I told us that the heart has an electrolyte. Electrolyte is the water, the mixture that gives the electrical signal the power to be produced. That thing that produces the signal, that thing that gives the connection the opportunity to produce signal so that blood can be sent out. When the electrolytes, when there is a downness or a downing in the electrolyte is no longer working well. In this case, either potassium or calcium abnormality. When there is an abnormality in the electrolyte formation, then ventricular fibrillation can occur. Then there's another one, severe heart disease. When there is an underlying disease that is in the heart that is not well treated, then that can also occur. They will also have drug toxicity, intoxication, illicit drugging. When you keep taking drugs, and or even excess alcoholism, can also cause the ventricular fibrillation. We also have another thing that causes is also electric shock. When you are shocked, when you are electrocuted, or you're under one form of trauma or the other, it can also affect the heart. When you are traumatized, it can affect the heart. And the effects it can give, the effect of this ventricular fibrillation, for you to notice that you are having it, there's usually no effective heartbeat. The heartbeat will not beat normally the way it should beat. The heart is supposed to beat like 100 to 120 times in a minute. So sometimes you see the heart beating lower than that or higher than that, right? So when you have that ineffective heartbeat, then something signals to you that you are having ventricular fibrillation. And then loss of consciousness within seconds. You are losing consciousness. You have to take care of. You have to be very careful. You are having ventricular fibrillation. And also, if it is not treated, within that minutes, somebody will pass out. That is why when you have such scenario or such case occurring, the first thing you should do is to administer AED. If you are, if you have the skill, okay, if you have the skill, then you can administer AED and now help the victim that is under the attack. Now, how do you do that? Like I said earlier, the treatment to this is immediate defibrillation. Now, when you defibrillate, the heart is rearranged, and then you can now apply CPR. When you apply CPR, the next thing, I'm sure by then you must have called EMT, emergency medical technicians, for them to now start coming. By the time you must have finished your AED and done your CPR, the EMT must have come, and then treatment will now begin to be administered to the patient. Okay, so that is that on ventricular fibrillation. Now, the next one is ventricular tachycardia. Ventricular tachycardia, just as the name sounds, is the disorderliness in the normal heart rates. When the heart beats is not normal again, you have excess beats or less beats. Sometimes you have up to 125, 130 beats in a minute, or you have less than that. So one could be said to have hypertension or high blood pressure or low blood pressure, right? So when you have that, you are already having what you call fibrillation. Ventricular tachycardia. Sometimes your beats, the heart may beat up to 250 times per minute, to tell you how serious that can be. So when you are having such strange beats in your heart, you begin to palpitate. The person may not be able to control himself again. So you either become unstable, or you still may be stable, having pulse. When you are stable, tachycardia is when somebody is still having pulse. Unstable tachycardia, the pulse is you are pulseless, right? So, but that person must quickly be administered AED to. So if you don't administer AED to the person, then you are at the verge of losing the person. And they are, just as we have some things that can cause ventricular fibrillation, there are equally some things that can cause ventricular tachycardia. One of them is heart disease. When there is an underlying disease, or also when you have heart attack, it's a heart attack. It's what we call congenital heart defects. So when there's some kind of heart defects, these are underlying defects that are there that can trigger it. When the signal begin to set in, it triggers this. And also you can have electrolyte imbalance. When there's an electrolyte imbalance within the heart, and also you have drug intoxication. So these are 5 things that can cause ventricular tachycardia. I've told us the first one is heart disease. The second one is congenital heart defect. You have electrolyte imbalance. You have drug toxicity, and also have heart attack. These can trigger it. Now, for you to know that this is actually tachycardia, what are the signs? The first sign is that there is a reduced cardiac output. The blood that is coming out, that's being pumped out, is being reduced. There's a reduced cardiac output. And also, sometimes there's also an high increase of cardiac output. Like I told you that the beat cannot be up to 250. Sometimes can be less than 100. So there's a reduced cardiac output, and also there's an high increase in cardiac output. And it can also progress to ventricular fibrillation. Okay, when the heart will now begin to jerk. Okay, and also you can also have a palpitation. Okay, can have palpitation. So now what do? You also has to stabilize the person. Like I said, while we have a stable ventricular fibrillation and unstable ventricular fibrillation, we also have what we call stable ventricular tachycardia and unstable ventricular tachycardia. And in this case, ventricular tachycardia, just like that of fibrillation, the stable one is that you can still feel the pulse. Unstable is pulseless. All right. So when it is when you can feel the pulse, you can administer medication. But when it is pulseless, man, what you need to do is administer AED and also CPR for you to help the victim. All right. So now, why is BLS important? At least I just mentioned about two components of BLS, the CPR and the AED, which we are treating right now. So you don't need anybody to tell you that BLS is very important. For those of you who don't have this skills yet, and also those of you who have your staff that don't have this skill can happen anywhere. It can happen in the corporate offices. It can happen in the school. It can happen in your personal office. It can happen at home. It can happen on the road. Now, when we don't have people who are trained to carry out this operation, it becomes a difficult issue, especially when it happens, in the midst of novice, people who don't know what to do. So the how it is important is because anyone who has the skill will be able to recognize ventricular fibrillation and ventricular tachycardia and can easily swing in to save the life. So when you have somebody shaking, instead of you to turn it, another thing, say the person is either, is having some kind of funny disease, you quickly should understand what to do. You should be able to understand that this is either ventricular tachycardia or ventricular fibrillation, right? So, and once you are able to understand that, then the next thing is to swing into action by deploying AED to treat the VF and of course the VT, which is sometimes pulseless. Right, so when you have done that, what do you do next? Then you now administer early CPR. Okay, early CPR to defibrillate, to pump blood or take blood from the heart, around the system. Now, when do you use AED? That's the next part we're going to treat. When do you use AED? Now, you use AED when you see someone who have collapsed, who have lost pulse, or maybe you still have a little pulse, but the pulse is going out. So that is when you administer, so you have a sudden collapse of a victim, and you've checked there's no breathing, and the person is gasping for breath. Breath is going away, and like I mentioned earlier, there's no detectable pulse and all that. And also, you also have to administer AED as soon as possible, knowing full well that every second counts, every minute that passes without administering either AED or CPR, the victim loses 10% life. Okay? For every 10 minutes that passes without any help rendered to a victim, the victim loses 100% life. Every 1 minute is 100%. Every 2 minutes, every 1 minute is 10% off. Every 2 minutes lost is 20% loss. So if within 0 to 4%, the victim is not helped, the victim have lost about 40% life, right? If within 4 minutes to 6 minutes, the patient has not been helped, then the victim has actually lost about 60% life. If within 10 minutes and the patient or the victim is not offered any help, then the brain will begin to deteriorate. And once the deterioration sets in the brain, then there is a problem, right? So that is how important it is. Now, the next part we're going to treat right now is on AED deployment. What do you do? How do you use AED? Okay, it's going to be a very quick one. Now, the first of all, is to press the button to start it. You follow the prompt, you follow the instruction that has been given to you by the AED. AED tells you what to do. So when you switch on the button, the on button, now the first thing is to, before you switch on the button, you need to first of all attach. There's what we call pad. The pads are the points where the electric shock is being discharged. So now the first the pad that is on the left side is placed under the chest. Then the other one is placed above the chest or above the breast, just under the collarbone. Right? If you have a hairy person, the patient is hairy, I advise that you shave off the hairs so that the pad can easily, be stable on the chest. Right, so you place the one on the left under the breast and the other one on top of the breast. Even if it's a woman, you have to undress the person, remove all the clothes the person has, and then do that. So when you have put the pads, you can now stand clear. Okay, stand clear and then switch on the button, the AED button for the AED to start analyzing. When the AED starts analyzing, don't touch the victim. Don't touch the victim's button. The reason why you shouldn't touch the victim's body, the reason why you shouldn't touch the victim's body is so that there won't be any kind of variation, because there has to be a delivery of shock, okay, correct delivery of shock to the patient in order for the right result to be received. So if you touch the patient, there will be there will be an alteration of the results. The results might show you wrong results, or the device, the AED, will produce wrong results. So you need to stand aside and make sure there is no water. Remember, it is an electric shock. It's an electric device, so there shouldn't be any water. If the patient has sweat all around, you have to clean up the patient very well before you can place all those things around on the patient, before the patient can now receive the shock. So when you have done that, now follow the prompts of the device. The device says hit the button for the shock, you can hit it. Sometimes the device does the shocking by itself. Automatically it triggers the shock button, and then it will deliver the shock, okay, when it's necessary. And the device must have analyzed the entire system to see that there is need for the shock to be done, and then it will do that. And once it does that, and the entire system, the entire electrical connectivity is being reassembled and is reconnected well and realigned well, then there is now need for you to resume CPR. Okay, you resume CPR and begin to, because at that time the ventricular fibrillation and the tachycardia must have been set out, must be treated, handled by the AED. So the person handling, the professional who is now handling the patient can now commence CPR. So now remember, CPR most of the time is done 30 compression. In fact, the normal compression is 30 with 2 rescue breaths. Okay, sometimes you need to combine it with the AED. If there are two of you rescuers that are there, one person will be doing AED, the other person will be doing CPR. So the compression has to be done 30:2. If you want to understand what I mean by the compression, please refer to my first previous video on cardiopulmonary resuscitation for you to understand how to administer CPR. When you go through the video, you will understand what I mean. But meanwhile, we are going to have the practical very soon. Once the theory is done, we're going to have practical for the CPR, practical for the AED, and also the airway management. The airway management is going to come next after now. We're going to have the airway management. And again, before I forget, there's an important aspect you need to remember and also handle. Sometimes you may have the victim having an implanted device in the body, right? Maybe as a result of accident, the victim may have iron implanted in the body, in some part of the body and all that. Make sure that you don't place the pad where the implant is, all right? Otherwise, it will result to another thing. Okay, so, and also medication patches. You have maybe the person had injury and the injury was patched with plaster and all that. You don't place the pad there. Look for elsewhere and place the pad so that you can receive an adequate shocking, so that you will receive the right correct results. Right. So that's on that. So we're also going to look at some common mistakes one may make when you are administering or you are deploying AED. And please, it's very important. It's very important so that you don't make the same mistake. Now, the first one is not turning on the AED. You want to do a shock, or you want to deploy AED. You have placed all the pad. You didn't turn on the turn on the the on button. Please remember to turn on the button, the AED button, so that the AED can come up and begin to tell you what to do. And also follow the voice prompt. Don't ever ignore the voice prompt. If you ignore the voice prompt, you make a very big mistake. And also touching the victim. Don't touch the victim. If you touch the victim, when the system is still analyzing, the victim to release shock, there will be wrong result. You will interfere with the rhythmic detection. Right? You will interfere with the result that is going to be produced. So don't touch the victim, clear away, and allow the AED to carry out, his job, right? And also place the parts correctly. Don't place it incorrectly. These are some 4 mistakes one may make, and you are getting wrong, signals, and it is not good, because when you are making mistakes, remember the patient there or the victim there is losing life. So you are actually the one who is trying to resuscitate or recover the victim's life. So every mistake you make also eats up the chances of survival of the victim who is lying on the floor. So make sure you don't allow mistakes to be reoccurring. Okay, handle the mistakes very well, and make sure you stamp out every mistakes that may occur. Right, so in conclusion, AED is an essential life-saving device that can restore normal heart function, okay, during cardiac arrest. Is when the patient is under cardiac arrest and you administer AED, it can quickly and easily restore it. And you need to know when and how to administer AED or deploy AED to improve survival chances. So if you don't know how to do it, like I mentioned, just a few seconds ago, you keep making mistakes, and the victim is the one who is paying the price, because the life is going away. So you need to understand, go through my video over and over and over and get what I'm telling you, so that by the time we deploy the practical session, you will easily get what I'm talking about. Okay, and as you are going through through the deployment of the AED, also remember to always take it alongside the CPR, AED CPR, for best results. So when you deploy AED, you also deploy CPR for you to be able to get the accurate results, because when the AED gives way for the blood to flow, the CPR has to take the blood around. And also regular training and practice ensures confidence in the use of AED in real life scenarios or real life emergencies. So if you think listening to me is enough for you to carry out the operation, no, you make a very big mistake. You need to continue, do it, make it a regular exercise. You watch this video over and over, get yourself acquainted with the practice, right? Especially when the practical section will come, get yourself acquainted with the practice. It will really give you the audacity to walk in confidently and carry out whatever operation, whether it is AED or CPR or airway management. You can always do that. So that is that on AED. That's it on AED. So please remember, I told you early, AED is a device that helps to reorganize or reorientate the heart disconnectivity. So when that happens within the heart region, then there is need for you to deploy AED. So I urge you to please make sure you pay good attention to this video. If what I've taught you, it really makes sense to you, you understand, you are very interested in what I've taught you, please just look down under this video. You see the like button, share button, and subscribe button. Please subscribe to our channel, so to help you get more videos, because there are a lot of videos in the studio that you might still need to go through, understand, in order to help you, to really get the information, the accurate information, the comprehensive information, and then the fundamentals that you need to become a life saver and a life giver. Thank you very much for watching, and I hope to see you again in our next video. Like I said, our next video is going to be on airway management, and I'm going to teach you comprehensively what airway management is all about, so that you know how, as you are administering your CPR and you are talking about giving rescue breath, what is the relationship relationship between the blood and the oxygen. What do they do in the system, in the body? What does it do? Or how do they interact, and how do they help the system, to keep the system alive, or the body alive? What do they do? So these are the things you are going to see during our airway management, tutorial. And I really urge you to make it a point of a duty to always come to our studio to get this information, and it will really help you to become confident in what you are doing. See you next time, in our video. Stay prepared and stay alive. Thank you very much. Bye.